Hi there, my name's Mike Hearn. I'm a GP at Farnhope Medical Centre, and I just want to introduce our fantastic practice nurse, Sarah Coomer, who's presenting a talk to patients with chronic obstructive pulmonary disease, or COPD. It's a talk on inhalers and how to use them in this condition, which explains why there's a little bit of coughing in the background. I hope it helps.
This is the Volumatic. It's a bit large, I know, but it is probably maybe the best. So this is the MDI, right? So you shake it up. Take the dust cap off. I haven't got one on here anymore. There's usually a little dust cap like that on it. Take that off. Shake it up. Put it in here. You can't go in the other end, so you can't go wrong. Put it in there and hold it straight. Not up, not down, anyway, straight. Okay? Then I'll stand this way so you can see what's happening. Press this in just once. After you've shaken it, put it in and press once. And then take 5 big breaths in and out. Now the answer is with this, not too fast. Because if you do it too quickly, you won't get it down the back of your throat and down into your lungs. So this is how you do it, okay? Press, shake, put it in, press it. Now, you've got to go slow as that. It's absolutely no good going like that. You won't get anything. So long and slow. Then you take it out again, shake it again, put it in and do the whole 5 again. And the longer and slower you do it, the better. Okay? That's that. Now, there is a blue inhaler like this, there's a brown inhaler like this, there's a purple inhaler like this, there's a turquoise inhaler like this, there's an orange inhaler like this, there's loads of them. And it doesn't matter which one it is, the technique is the same. Okay? If you're doing it right, this valve here will rattle. You hear it rattling. Okay? If you don't hear any rattle, it means you haven't got enough breath to breathe it in, and then that's a problem. So you need to be in touch with someone. But that's the way you do it. So you need one clean one every year. Wash it up once a week. The instructions are all in the box when you get it. If you don't know what you're doing, ask, because I've got some spare instructions. And when you wash it, you can pull it apart like that and wash each side, and then don't dry it, rinse it, and put it on the draining board. Okay? And don't do your 2 puffs together, because a number of times people say, oh, well, I do it like this, and then they do this. Wrong. 1 at a time. 5 breaths, take it out, shake it again. So that's that. Any questions on this? So this is the aero chamber. It's the same sort of thing, except it's a smaller version really, but slightly different technique. Still shake it up. Still only one end you can put it in, like that. Still needs washing up once a week and draining just the same. But this one, you can't blow in and out so well. So basically you've got to do a big breath in and then hold your breath. So like this, straight on, press it. After you've shaken it, put it in. Hold your breath for 10 seconds. And then if you need to do it, usually it's 2 puffs, take it out, put it back in. Okay? If you're using the blue inhaler and you're really wheezy, for the emergency sort of standby, you can then wait 5 minutes. If you don't feel better again, you can repeat the 2 puffs again, and you can go on doing that until you've had 10 of these. And if you still don't feel good at all, then you come to the surgery or you ring an ambulance. You don't have to worry about ringing an ambulance. They'd much rather come to you and it be a false alarm than not come to you, and it could be disastrous. Okay, this one, if you make this noise, you've gone too quickly, and that's the warning. Absolutely hopeless. You've made a complete mess of it and you've got to start again. Okay? So, if you get that noise, it's bad. So, do it again. And it's good it makes the noise because it makes you do it really slowly. It's really easy to get the noise. Most people do get a little bit of a noise, but if you do, you haven't done it quite right. And you have to learn, the slower and deeper you do it, the better. Okay? So these are the 2 spacer devices. And really none of you should be putting this straight in your mouth. This is the one called the Easy Breathe, which we use quite a lot of, and that's for people who perhaps don't need to have one of these. You can attach these to these, but it's not, we don't recommend it. So you shake it, pull the front down. You don't have to do any of this pressing or anything. You don't put your hand over the top of this little air hole. You hold it straight and you just breathe in again, slowly. So the breathing in triggers the device. So you just go. And then you do it again. So you shake it, you pull the front down. Pulling the front down triggers the dose to be loaded up. Put it in your mouth and breathe in. Hold your breath for 10 seconds. Okay? Now, people say, oh, I don't like any of that. They do this. They pull this off, they take that off, they do this, then they press it down like the old-fashioned one. No, that's all wrong. The whole device was invented, actually. It got the Prince Charles something initiative device, something or other, because you don't have to do all the pressing, so the coordination doesn't have to be so good. If you start doing this, you're back to this again. The only time you might need to take it off, because they don't have a number on here to see how many doses you've got left, is to take that out to see if it feels full or empty. But you certainly don't take it off to actually take it and use it. So don't do that, because it messes up the whole of the system.